Good morning, everyone. We're going to get started here right at 8:30. So welcome. And thank you all for taking time out of your busy day to come and be with us today. We really appreciate it. As you know, this is an invitational conference, which means either you or someone that you know and thinks highly of you recommended that you should be with us today. So we really appreciate you coming to be with us. We hope that you're going to be informed and inspired and hopefully make some great connections and network with other participants here today at the break and in the roundtables this afternoon. So I think I have either emailed or I know many of you, but for those who don't know me, I'm Marie Smith. I'm the Assistant Dean and also the Henry Palmer Professor at UConn School of Pharmacy. So we'll try our little handy clicker here. Okay. And I'm going to serve as your moderator for today. And we have a great list of speakers and panelists and hope that you will feel very engaged in being a participant by asking questions along the way. So the first thing I wanted to mention is this is called the PRISM Symposium. And many of you are probably saying, well, what's PRISM? So the dean, when Dean Halpert gives his opening remarks, he'll tell you a little bit more about PRISM. But just in general, it is an initiative that's at the School of Pharmacy. PRISM stands for Performance Improvements for Safe Medication Management. And you'll see there are 4 categories or 4 buckets of activities. And that really is what shaped kind of the planning for our topics we're going to discuss today in presentations as well as in our roundtables. So that includes skills-based education, practice-based research, very pragmatic, real-world research, health services and policy research, as well as team-based care delivery. So we hope that, and we have a website. It's these slides, by the way, are all in your booklet, so you've got them. The website for our PRISM pages on the School of Pharmacy is listed there as well if you want to go and find out more or follow up with us after the conference. And we hope that out of this, our goal is to create some new partnership opportunities or expand existing partnership opportunities that you might have with us based on some of your needs and some of our expertise. You can't put any kind of an event on like this without a lot of people behind the scenes. So I want to this is our big thank you page. So we had an external advisory board, our planning committee you see listed there, meeting coordinators, big shout out and thank you to Joanne Nault, who is in the back of the room and she can wave or whatever. So thank you, Joanne. She did a lot with our logistics and our site and registration. She was the one who sent all those emails to you every week to say, please come. We had some marketing partners, marketing meaning that they helped us with distribution of the invitation to select lists. So you see them listed there. UConn Institute, CHIP Institute, the Connecticut SIM Project Management Office, and also SIPSI out of a joint venture between UConn and St. Francis. And then lastly, in green, is the money guys. We couldn't do this. As you know, it was free registration, so I want to thank our department chair, Mike, if Mike can just kind of wave so everybody sees Mike, and the dean, Jim Halpert. So between our department and our dean, we were able to get the funding to make this a free event for everyone. So with no further ado, I'm going to introduce someone who probably needs no introduction in this state, but Vicki Veltri, many of you know, is working in the Lieutenant Governor's office, and she's the Chief Healthcare Policy Advisor. So Vicki has a few welcoming words.
Good morning, everybody. I'm so happy to be here today on behalf of the Lieutenant Governor, who couldn't be here today. I wanted to send her greetings to all of you this morning. That picture, oof. I'm proud to say that picture is probably 20 pounds ago, so that's good. And the last time I think I was at this location was for my mom's 70th birthday party. This is a great location for a conference. And at lunchtime, go out and explore the grounds. They're beautiful. But anyway, this topic today is very timely, as you all know. First, while I'm here, I want to thank Dean Halpert. I also want to thank Marie Smith, who I know has done a huge amount of work to put this program together on such an important subject. Speakers today, as you know, are experts in transforming the delivery system in one way or another. There's nothing more complex, as you can tell by watching TV every day, than healthcare and the systems that govern delivery, innovation, and reform. Healthcare is among the most important barometers, I think we all know that in this room, of a society. I'm really proud of the work we've done in Connecticut, on healthcare and reform initiatives. And the stronger our partnerships with all of you in this room and people outside this room, the better our healthcare will be for everybody. As you know, our state really embraced the Affordable Care Act. We made a lot of progress under the Affordable Care Act. We'll have to see where things go with the Affordable Care Act, but we're still a state, despite the progress we've made, that faces significant disparities in access to care and outcomes. And if we're going to do something about that, we really need participation from every sector. In Connecticut, we launched our SIM model, our State Innovation Model Test Grant, to bring together public health strategy and healthcare reforms to narrow inequities in healthcare, lower costs, improve quality in healthcare. Mark's going to talk, I think, a little bit about that, so I won't talk too much about that now. The healthcare cabinet that we have, which is one of our stakeholder groups in the state, is investing a lot of time in exploring methods that the state and others can employ to bring down the cost of pharmaceuticals. We've brought together members across industry, advocacy, and government and academia to improve healthcare delivery. The cabinet's work group efforts includes methods to educate customers about the proper use of medications, pursuit of joint purchasing, value-based and indication-based pricing, and embracing the role of the pharmacist and community care teams. And that's an area I know that's going to be delved into deeply today, and we need to explore further if we're ever going to bring down the cost of healthcare and improve healthcare quality. One of the things we did discover in our work as a cabinet over the last couple years is the need for significant work around medication reconciliation and Medicaid management, and the role of the pharmacist in doing that in primary care particularly. And you know, because it's important for the state to support providers who need tools to participate in newer models of care, our health information technology infrastructure is critical, and we brought on leadership at the state in that area. So our reform efforts right now are in a critical phase. We need to get a handle on healthcare costs, no question, ensure value for the dollars that we spend, and expand the accessibility of healthcare, especially to address these health equity issues. As you know, just as a final thing, I want to talk about this Office of Healthcare, or Office of Health Strategy we're developing, which will be the state's first overall framework for health policy strategy that will allow us to unify our data to make data-driven policy and coordinate cost containment strategy decisions. The OHS, yet another acronym. You're all in healthcare, so everything has to be either 3 letters or 4 letters. So OHS will drive towards effectively limiting healthcare cost growth and otherwise act as a coordinating structure for the state to improve outcomes and hopefully limit cost growth across all sectors, whether private or public. So I want to, in summary, I want to thank the UConn School of Pharmacy. The UConn School of Pharmacy has been a tremendous partner in the work that we've been doing as a state in our SIM program. I know Marie especially has been a very strong participant with our SIM program. Our healthcare cabinet work by participating on our work groups as we've done a cost containment study, and now in our pharmaceutical work groups, UConn is playing a key role. And in our work with our health information technology development, UConn is playing a key role there in our medication reconciliation use case design that we're doing. So UConn has been a tremendous partner to us, School of Pharmacy. This is going to be a great session today. Government is a really good partner. Our government can do things, but you guys are the partners we need to really succeed, and we count on all of you to help us shape the policies that will help us achieve our goals. So what you're doing here today is a key to progress. Hope you have a great conference, and we're going to learn from you here today. So thank you again.
Okay, so our next greetings come from, I'm sorry, should be from our dean. There he is, okay. So Jim?
See, Vicki, you were lucky. In my case, they didn't use the 10-year-old picture I gave them. So, anyway, I'm really happy to be here. I want to deal with one issue. We all wear many hats. You know, sometimes you're the idea guy, sometimes you're the go-to guy, often you're the fall guy. So I guess I'm okay being the money guy, but I want to be clear in this time in the state history. It's not like the UConn School of Pharmacy is swimming in money. We do have some endowment funds thanks to the generosity of donors, and I was really extremely frugal with those the first 3 years I was here as dean, and then Maria and I started talking and realized it had been about 5 years since the last symposium like this, and this could be a tremendous investment in not only our own activities, but I think in promoting health and welfare within the state. So that's how we're managing this. So I thank you, Marie, for trying to define PRISM. I always stumble when I do that, so at least you've had that definition for you. That's been around now 5 years, and basically the goal is to improve the health of the people of the state of Connecticut and the region through safe and effective medication use. And there have been 4 elements to that: interdisciplinary educational programs, community-based research collaborations, healthcare transformation policy opportunities, and team-based healthcare delivery. So when I got here in 2004, I'd already had a couple extensive phone calls with Marie, so I was prepped that we really needed to invest more in PRISM to achieve a critical mass of faculty and staff to really be able to have the kind of impact that I think the program merits. So I started working right from day one with Mike White and Marie, trying to figure out how we could make PRISM an effective strategic priority for the school. And so, you know, we only have about 40 faculty, so if we hire 2 faculty in a particular area over a few years, that's actually a substantial investment. So we've been able to do that. And they're here today, of course. And we've also started a Henry Palmer Fellowship in Pharmacy Practice that complements the expertise of the faculty. So this is kind of the core group of people, but in addition, there's at least, I would say, almost half the department who are involved in various scholarly activities and practice-based activities that are certainly related to and support of PRISM. And I'm glad to see a lot of them here today. I'm also glad to see a lot of people I don't know, which means we did really reach out and attract a lot of other individuals. So that's terrific, too. So I think we're going to have a great day of talks and poster presentations and panel discussions, roundtables. A good lunch has been promised as well. So there are really 3 goals for this conference. It's really to try to inspire you, encourage you to work with us, partner with our schools so we can start to solve some real-world medication-related problems. And ultimately, of course, that should lead to better patient care, healthier populations, and smarter healthcare spending. So just great to be here, and I'm looking forward to learning a lot and hearing the rest of the day. So thank you.
So I know that some of you know this word, VUCA. How many people know what VUCA stands for? No? Oh my goodness. Susan does. Okay, good. So VUCA stands for volatile, uncertain, complex, and ambiguous. Do you think you have that in your daily work? How many people say, yes, I have that, right? Looking at Jim Watley here is trying to figure out, like, where's my funding coming from? Everybody's looking at that, right? What's happening in the, as Vicki said, the federal environment, how's that going to impact the state? And then just how does that trickle down to what we each do in our own daily lives? So what we hope to do today, in a really short one slide, how do we convert VUCA into some opportunities to think about partnering with us in our expertise at the School of Pharmacy. So we're going to use the PRISM acronym, or try to. So today we're going to have a number of presentations from speakers, from panelists, and then also at roundtables. We're going to give you ample opportunity to relate your needs to us with Q&A and also in the roundtable sessions to share your experience and your greatest needs in the medication-related space. And we hope to innovate through enhanced or more of our private-public partnerships to solve real-world challenges regarding medications, with the ultimately looking at the result in medication optimization, in better patient outcomes, smarter spending. And the fourth one, what we don't always hear in the triple aim is, which you hear in the quadruple aim it's now called, is restoring the joy of practice for everyone, for the patient who's part of that team, as well as for those of us who are in the clinical realm as well. The 5 secrets to surviving in a VUCA world really shaped how we went about organizing the topics in the format of today's conference. Ask different types of questions. So we have to do something different. Ask different types of questions, the hard questions, maybe the ones that you're reluctant to bring up and talk about. Take on multiple perspectives, form thinking collaborations. That was a new term that I stumbled across here recently, but I think it says a lot. How do we form collaborations that aren't just convenient, but really are getting at solving real-world problems? Zoom out to see the whole picture, but then sometimes you've got to zoom in to see what's really possible and how do you go about addressing it. In your material, you see this, and this is the modification of the question we've had at the last 2 conferences that we've held, and we modified it a little bit. But today, the burning question, what's that different question, new question, is how can pharmacists on integrated community-based care teams collaborate with all the stakeholders that we have represented here in the conference to improve patient engagement, optimize quality and health outcomes, and lower total healthcare costs. So if we can get that done today by 3 o'clock, I think Mark will be out of a job maybe. But anyway, we're going to see how far we can go with that. A couple of quick slides that if you were here last time in 2012, you might say, gee, I've seen that slide before, and you're right. There are components to looking at in a value-based program that looks at medication use, safety, and costs, 4 basic components. So you see them there, formulary PBMs, formulary management, benefit designer on the left-hand side that focus primarily on product utilization and cost. And on the right-hand side are the patient care outcomes, quality types of components around pharmacist services that you're going to hear a lot about today, and about care management as well, interprofessional care management. So the breakout under the left-hand side is prescribing and utilization in red. Those you're going to hear about in some of our speakers' talks. And on the right, you're going to see a lot around med optimization, collaborative practice, community clinical linkages, self-management. Susan's going to talk to us a lot about outreach in terms of what happens with healthcare without walls. We're going to talk about e-health and e-consults in our roundtables. So the value equation you see here, the value-based programs have to have the 4 components. Most of our discussions today, or most components, focus a lot on this part, which is really critical. But you know what? That's really what we've been focusing on for the last, 40 years or more? We need to work and start moving our attention over here. This is the base. We've got to expand it over here. If we focus only on the cost pieces, then we miss all the compounded value of the synergies that come from managing appropriate, safe, and cost-effective care that come from those team-based care, collaborative types of practices. And the last slide I'll have to just set the stage for what we're going to hear about today is this slide is really focusing on the spectrum of pharmacist services. If you look at the intensity, as the intensity goes up from medication adherence counseling through MedRec, targeted MTM, comprehensive med management, if these terms aren't familiar to you, you'll see them again in the quiz at 3 o'clock. And then med monitoring and what happens between visits. Okay, the speakers are going to talk all about these, but I wanted to show you the big picture here. So as you go from the lower intensity to higher intensity, you also see there's a greater likelihood that you're going to move towards, and you need to have interdisciplinary team collaboration as you increase. Corresponding, there's a greater impact of coordinated care outcomes and cost savings when we get up to the higher end. The other thing is, several of us in this room along with our state Medicaid program, probably 8 years ago, had the opportunity to do a CMS Medicaid transformation grant before we probably even knew what transformation meant in this state. And what we found was that the majority, about 70 to 75% of drug therapy problems that were in the outpatient setting that we found in these complex Medicaid patients, and this has been replicated by colleagues on the West Coast in California as well as in the Midwest, 70 to 75% of drug therapy problems in the ambulatory arena happen upstream, meaning more closer to or at the point of prescribing, monitoring, med management. So you can have a greater impact on cost. I'm sorry, yeah, what happened? I went way back. You can have a greater impact on cost and outcomes the more you work on the upstream side. The downstream side is the one we probably think about. If somebody said, what's the greatest problem, you'd probably say adherence based on what you hear today, right? That only accounts for 20 to 25% if you're looking holistically at the whole system, okay? Not just what happens with patients, but the whole system. So the key takeaway message is your high-intensity pharmacist services, the upstream services, focus on preventable, so we want to prevent drug therapy problems, and we want to look at those modifiable medication risks, and they will have the greatest impact overall on both quality and our spending for total healthcare costs.